Good evening. My name's Olivia. I go by Olivia K on Facebook, Ollie K on Instagram, and Mormiam 9800 on Reddit. So I cover nursing related materials, including NCLEX. I talk about documentaries, reality TV shows, or whatever shows that what you would love me to talk about. So I just recently watched a Michael Jackson film, so I do have a video up of that and my reaction, my review on it. I also have just finished Temptation Island season 2, even though that was a dull watch, so the video's up already. I have a playlist of documentaries I've seen, and also I almost said Love Island, but I don't watch that. Love is Blind, if you're interested in my take on that. So I would like to talk about nursing related materials today. So I am going to go over, and actually I'm going to start doing a series called High Yield at Med Surg Compare and Contrast Disease Processes. The reason being is that with NGN styles, they like to compare and contrast different disease processes that sound similar, and NCLEX wants you to see which one you can recognize, and which, with your quick thinking, which interventions you will perform in order to keep this patient safe. So with that said, let's get into it. On the NCLEX, they typically will compare and contrast disease processes, just as I said, because the NCLEX wants you to know if you can properly, they want to know if you can properly tell what the patient may be suffering. Unfortunately, like I said, a lot of disease processes do sound the same. They sound very similar. And it's up to us as nurses to figure out the key differences to maintain or keep the patient safe. So like I said, I'm going to do a Med Surg series. And I am going to start off with DKA and HHNS. So they are both similar. What they are, before I get into the similarity and differences, I'm so sorry. I know it's so bright. I apologize. All right, I think that's my bill over. I'm so sorry. It's the sun's setting right now. Okay, so they're both complications that stem from untreated hyperglycemia. So each of them do have similar but different manifestations to be aware of, okay? So you need to be aware of what's going on with them and how to act differently. Because you may get these, I know you will probably get some of these on the case studies, or like the type of questions where they're going to have both of the diagnoses, the diagnoses, and then they'll have the symptoms, and you need to figure out which one's which. I know I got a few of them on my Q banks when I was studying. So in DKA, you're likely going to see like glucose levels over 300. So the symptoms that you'll see in them would be like would be nausea, vomiting, abdominal pain, weakness, fatigue, and starting underlying this part, fruity breath. So that's basically the presence of ketones. So that's the difference you're going to see between DKA and HNS. You're going to have what's called Kussmaul breathing. Dehydration definitely is present. So you mostly will see this in patients with diabetic mellitus 1, type 1, basically. So because of the process that's going on, there's a huge risk you're going to see acidosis. So remember how we just did the ABG lecture? So basically, you will see metabolic acidosis present with this patient. Electrolyte imbalance, because there's way too much of the potassium. And I know I talked about when a person goes into DKA, they need to have insulin, because the insulin is going to pull back the potassium back in the blood cells. Not just blood cells, but the cells. So I hope that makes sense, and as you listen to this. So then we're going to discuss HHNK, which I don't see often. I'm only seeing DKA like maybe once because I had a patient with diabetes with type 1, and he was around my age, which kills me when I see people my age that's sick. So I've only kind of seen that happen, but I've never seen HHNS. So with that, you're going to see glucose levels over 600, which I have seen patients over 600 and they are fine, no symptoms. So the symptoms you're going to see will be your polyuria, polydipsia. So one thing I neglected to just mention too, with DKA, you have your 3 Ps, and that's normally what you'll see in a typical hyperglycemic patient. The 3 Ps will be polyphagia, polydipsia, polydipsia. But in HHNK, it's different. So you're just dealing with the 2. So the polyuria and dipsia. So they're very dehydrated, if that makes sense. So again, what I just said, they're very dehydrated, severe hydration. So their skin's going to be warm. They're not going to be sweating, which will be a risk for overheat to them with them. And then you're going to definitely see more neurological symptoms. So definitely start underlying these. So that's where you're going to see the difference between DKA and HHNS. So they will have headache, lethargy, seizures, big star underlying with that one. Because anytime you see seizures in a healthcare setting and whatnot, that person needs to be like seen immediately. Do not delay treatment with those kind of patients. And you typically will see these for patients with type 2. And again, I haven't seen that before. I've never seen anyone with HHNS, but it happens. So they have a huge risk for severe dehydration and neural changes, that I just said. So here's where the similarity is now. Both treatments are the same. So they need the IV normal saline, which I have mentioned in my diabetic pharmacology lecture. So they need the IV normal saline first. So that's the first line treatment, okay? Then after, they get the insulin. So especially with HHNS, they need to have the IV fluid, period. Then they need to have the insulin. But before you do that, you want to assess the potassium levels, because that's going to be off the roof. And there are huge risks for hyperkalemia. And that's going to lead to dangerous arrhythmias, like I was mentioning a few videos ago. So which is why it's so important that electrolytes are checked. And then you're going to give the insulin, because as I said, insulin is going to pull back the potassium back into the cells. This is very important. So please start underline what I just said. This is important. So it's regular insulin only. Remember what I talked about? That's the only insulin you're going to give IV. Everything else you're not going to administer. Regular is the best kind of treatment in these kind of situations with the DKA and the HHNS. Regular insulin IV. The monitor labs and check ABG. So again, these patients are going to go into metabolic acidosis, especially with DKA. And there is an underlying cause to cause all this, okay? So you want to check for underlying causes such as stress. So they could be recovering from surgery. They could be going through a fever, for all we know. They could be having an infection brewing in them. Or insulin non-compliance. So that's another reason why they could get into these. So definitely keep those in mind when you get these kind of patients. And when you're studying and when you see these kind of questions in your Q banks or ATI, especially ATI. I know ATI is going to test these. ATI does not play games. I know how hard ATI is, but at least now you'll get some questions correct once you come across these type of questions regarding diabetes or regarding DKA and HHNS. So that's that. So tomorrow I'm gonna go over right and left heart failure. Although I know some people they're like, well, yeah, I can tell the difference, but it's easy to mistake either side when you're coming across these kind of questions. So I will do those for tomorrow. And tomorrow, I think I'm, let's see, I think I'm going to do America's Next Top Model. I know that came out a while ago, but I'm going to go over the documentary and just go over my opinion and stuff like that. And that's about it for now. Anyways, take it easy and have a good evening. Stay safe, and it's beautiful out, so enjoy. Take it easy. Have a good one. Bye.